when you get people who come in and see you for peels, what kind
Yeah.
of things are they asking? What is it that people are most either confused about, or what are the sort of things that they have preconceptions about?
I think the main thing that people ask is, how many am I going to need? People ask how many they need.
Yeah,
It's in combination with an excellent skincare regime, and
yeah,
it's managing expectations. So
yeah,
it's how much does somebody want to put in time, effort, and money into what they
yeah.
want to, achieve. So
Yeah.
um,
But do you think more is always better, or do you think it comes down to things like skin type as much as anything else, or how they're presenting to begin with? Because I find that when I see patients, there's some. I think you're right. It's about managing individuals' expectations because everyone's going to be different. So
yeah.
you get some people who have never heard of a peel, or have sort
Mm.
of idea this assumption that they're going to be sort of like literally peeled red raw. Um, and then you have other people who sort of had them before, and so but sort of underestimate how much they're going to need.
Yeah, I mean, I think it definitely your starting point is a definite factor as well. So
Yeah.
when you've got a younger skin type and you've got little
Mm.
damage there, it can be used as a preventative measure. So
Yeah.
your younger skin type, you'll have its maintenance. So you might have a couple of peels, every other month, or one every 6 months, something like that, as just maintenance.
Yeah.
Whereas the older skin types, you might have a course of treatment, but then after that, then you'll go into maintenance, because obviously with the peels, with anything, there's only so far that you can go,
Yeah.
depending on your age and your skin type, and the damage that's been done. But you'll get as far as you can go, and then it will just go on to a maintenance, so that hopefully things won't progress as rapidly.
Yeah.
So
And I mean, you've had them done as well. I mean, since we've done them in the last couple of years, what
well,
was the thing that you noticed the most when you had them done yourself?
having them done myself has been amazing. And the thing that I really notice is that I have a little bit of sun damage on, well, particularly on one of my cheeks, and I noticed that evens out so much after I've had a peel, or a course of peels. Pore size definitely
Yeah.
dramatically reduced for me, and that's the thing that I find is so nice, is that the texture of your skin is so much better after you've had the peels, that even if you're not happy necessarily with the tone of it, when you apply makeup to it, you get a much better finish. So just
I mean,
from
it's really interesting to hear, because I mean, this is one of the things as a guy, you sort of find it, you don't necessarily think about these things. And I found that when I had mine done, it was
yeah,
just tightness, and there was almost like a cleanness to it. It just
yes,
you just feel sort of really clean. So it gets rid of so much grime and rubbish. But
yeah.
what do you think people are saying the most? What's the thing that surprises people the most when they've had them?
I think it's the fact that it's not painful. I think
Yeah,
that surprises people the most. I think that, like you said before, they are expecting to have their face burnt off and to have a lot of downtime. There isn't very much downtime at all with them.
yeah,
Um, the most severe, I suppose, reaction that I've had to it is somebody had flaking a couple of days later.
yeah. And
Um,
that's so normal. I've had that as
yeah,
well, and it's nothing.
yeah,
In the grand scheme of things, it's nothing, given it's
yeah,
and that settles after a few days anyway. So it's not, and it's
yeah,
so manageable. Um,
yeah,
I think
yeah.
it's a pretty, and that was, I'm assuming that was with one of the deeper ones anyway.
Yes, it was. Yeah,
Yeah,
it
so
was.
it's an
It was one of
aggressive
the,
peel. Yeah,
and it was actually the first time that she'd ever had a peel. So it was always going to be the sort of the worst one is always going to be the first one. And
yeah,
to be honest with you, she was pleasantly surprised that actually it was fine. And then thereafter that, she got the initial sort of redness, but when I say redness, it's more of a healthy glow. You
yeah.
definitely glow. I think there's a photo of us on the Smile Kind on Insta, and we've all just had a peel, you, me, and Emily, I think, and we
Yeah.
are just glowing. We look
It's a good
radiant.
look. No, it's good. It is, and I mean that's the thing, because I think traditionally peels was sort of so aggressive, and these are really gentle. So you can do them light, like you say, before you've got big events and things to just cleanse, or
Yeah,
we tackle the sort of bigger, more complex skin types and skin problems, so the sort of deeper set wrinkles and things like that. And I was going to say, so like on average, how many treatment sessions do you think people are getting the best results out of?
I think the average is to have sort of a course of three to six. and then to then go on to maintenance. And I have one particular client who had their 6 peels to start with, and then she now has a course of 3 every 6 months.
Okay.
And
Gotcha.
that is really great for her to maintain. And she's not a particularly young skin type either. I would say she's sort of in her 40s. So again, she's not particularly old skin, but also she's not, particularly young. So it's a good average
And
to take.
what was bothering her when she started? What was the first sort of like thing that got to her? What was
She,
the reason she said, "This is what I want to do"?
she had some acne scarring,
Okay.
and actually it was relatively mild acne scarring, but it was the same thing that a lot of people say is when you actually say to them what bothers you about your skin, they'll start off with one thing that they think is bothering them, and then actually when they look in the mirror, they go, well, actually, I I don't like the dullness, and I don't like this, and I don't like that, and so it can be a combination of things. But for her, it was the skin, the texture, and the acne scarring, which is really evened out now that she's having had the course, and that's why she's maintaining. She comes back every 6 months, has three. She actually enjoys the treatment as well, which is lovely, and she enjoys how her skin, like you said, that fresh feeling. She feels clean after she's had them done.
It's the irony, isn't it? Because so many people come in with sort of this perceived problem, and actually, a lot of the people want to sort of have Botox and fillers. That's the sort of default setting, and actually, there's
Yeah,
so much more. I mean, and peels are cheaper than a lot of this stuff. And actually, that's the thing that people see. People see your skin, and that's what
yeah,
you see, and that's actually what most people are actually bothered about. But I've never thought about how to fix or adjust or
yeah,
sort of pay
yeah,
attention to, and actually it gets
yeah,
the most, I think, impressive results because it's usually like you say things like sun damage or tone or texture or acne scarring and
yeah.
stuff which really bothers people that has been hanging around for years or slowly building that then all of a sudden comes to a peak, and that's actually what started a lot of people's problems.
Yeah, and it doesn't have to be a big treatment plan either. It can be that they come in and they say, well, this is what's really bothering me. So, well, actually, we can do a course of pills, and then we discuss skincare regime as well. I'll happily give advice on what they should be doing day to day, so that they'll have their course of pills, and then they can maintain a lot of the stuff themselves, because that's another big thing is people come in and I'll say, what's your skincare regime now? And it's soap and water, and that's not going to keep the skin looking youthful and healthy very long, soap and water. So I'll go through everything that they can do day to day to keep things looking really good.
Yeah, and luckily we've got stuff at the clinic, so the
Yeah,
medical products as well that are sort of going to complement all of this, that prepare the skin, make sure that it maintains its health and sort of prevents damage as well. That's the real key thing because there's no point investing in any of this if it's then going to just be reverse or you're going to do more damage to it.
yeah, absolutely. Yeah, and it's things that like just using a moisturizer with an SPF in it. People don't realize that you can get that, and it's something that's a preventative measure that's going to help keep everything nice and healthy.
Even mineral makeup with foundation in it, that's great stuff, and that is not expensive, and it's just an
Yeah,
easy, simple change that people can make in their
yeah.